Let's move to the other complication of gallbladder stone, or the choledocholithiasis. Okay, so the other complication, first we talked about the first complication, which is inflammation of the gallbladder itself, what we defined as acute cholecystitis. Okay, now what if the stones that are in the gallbladder, one or more of them, slipped out through the cystic duct, okay, and went into the common bile duct, okay, and stuck there? In this case, we have what we call the choledocholithiasis, okay, which is stones in the common bile duct. Stones in the common bile duct. Most of the stones in the common bile duct are of secondary origin. They are stones that were in the gallbladder and slipped out of the gallbladder through the cystic duct, but still we can have primary common bile duct stones, okay, common bile duct stones that originate in the common bile duct, not in the gallbladder. This is more common actually in Asia, and the patients will have most of the times brown pigmented common bile duct stone. In the cases of gallbladder stone, choledocholithiasis, we will have cholesterol stones most of the times. Now, how to diagnose this patient? Actually, most of the times the patient will come with what? He will come with jaundice, yes, because there is an obstruction in the common bile duct. Here, an obstruction, the bile will not be able to pass into the ampulla of water into the GI tract. Okay, so here will be bile saturation and accumulation, and this will lead to jaundice, of course. Okay, and the bilirubin will be in some place between 3 to 8 milligram per deciliter. Biliary colic is also a common presentation. Okay, you can find biliary colic in a lot of cases of choledocholithiasis, a common presentation beside the jaundice. On physical examination, you may only see icterus, okay, and in ultrasonography, the common bile duct stones or choledocholithiasis are to be seen just in 50% of cases, okay. Just in 50% of cases you can see the common bile duct stones, but still you can see the origin of these stones, the gallbladder stone. Okay, so this is the acoustic shadow of the gallbladder stone. This is the gallbladder stone, and this may be the only finding in ultrasonography for choledocholithiasis. So we did physical examination and we took history, and after that we did ultrasound. Okay, is there any other thing we can do? Yes, we can do endoscopic retrograde cholangiopancreatography, okay, or MRCP, ERCP or MRCP, and actually they can visualize some common bile duct stones like we can see here. Okay, so these are common bile duct stones seen in ER and MRCP, and actually this will confirm the diagnosis of gallbladder stone. Common bile duct stone, I mean. Actually, intraoperative cholangiography during the surgery, okay, occasionally can confirm the diagnosis of common bile duct stone. Now let's move to the management of choledocholithiasis stones in the common bile duct. We said that in most of the times, if we have stones in the common bile duct, we also have stones in the gallbladder, and the gallbladder stones are the source of the common bile duct stones. So if we diagnose a patient with choledocholithiasis, what to do? Okay, how to manage this patient? Actually, first of all, we have the surgery is indicated to remove the gallbladder. We do laparoscopic cholecystectomy, okay, and after which we want to explore the common bile duct, so we do intraoperative cholangiography, okay, intraoperative cholangiography, so that we visualize the common bile ducts, possibly followed by intraoperative common bile duct exploration, okay, laparoscopic exploration, I mean, okay. And after the laparoscopic exploration, if we find a common bile duct stone, we can do many measures to remove that stone, like irrigation, IV glucagon, or a blind passage of what we call the balloon catheter, okay, or the stone basket. This is, as you can see, a basket to remove the stone, okay. This is the basket to capture this stone, or we can introduce some kind of balloons like this, okay. So balloon to open the bile duct to release the stone, and we pass these devices through choledocoscope, okay, choledocoscope. And if the bile duct cannot be cleared of stones by the laparoscopic exploration, as we said, we do open bile duct exploration or post-operative ERCP, okay, post-operative ERCP. But this is uncommon to happen. But what if the patient is not a good candidate for surgery? We can't do surgery for this patient, or the patient has cholangitis or prior cholecystectomy. What to do? Actually, what to do in this patient is to do ERCP with sphincterectomy. Sphincterotomy, okay. We open the sphincter so that we can pass the stone by ERCP. So sphincterotomy, okay, as I said. So this is all about the management of choledocholithiasis. In the subsequent video, I'm going to talk about other complication of gallbladder stone, which is biliary pancreatitis. Okay, thank you very much for watching this video. See you in the next video.